must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
So my fellow Kenyans, on Friday, March 6th of this year, the government of Kenya received confirmation of the first case of COVID-19, more commonly known as coronavirus. As you may recall, when we first announced the confirmation of the first case, we did state that we had traced 27 persons who had come into contact with the first patient. We have since tested all 27 people at our National Influenza Center, and today we have received confirmation of 2 more cases of the coronavirus. The 2 have tested positive as a result of coming into contact with the first patient. Our health officials have already moved them into Kenyatta National Hospital isolation facility. Teams are closely monitoring the patients who are reported to be in stable condition and responding well to treatment, and this indeed gives us hope. Fellow Kenyans, my government has been working to monitor the spread of this virus, and we have set up necessary containment and treatment protocols across the country. However, following the results of the 2 additional cases, we are now, this evening, directing the following additional protocols. Number 1, the government is suspending travel for all persons coming into Kenya from any country with reported coronavirus cases. Number 2, only Kenyan citizens and foreigners with valid residence permits will be allowed to come in, provided they proceed on self-quarantine or to a government-designated quarantine facility. This will take effect within the next 48 hours to cater for any passengers who may be en route. This directive will remain in effect for the next 30 days or as varied by the National Emergency Response Committee. Number 3, all persons who have come into Kenya in the last 14 days must self-quarantine. If any person exhibits symptoms such as cough or fever, they should present themselves to the nearest health facility for testing. Number 4, we have suspended learning in all our education institutions with immediate effect. Consequently, and to facilitate a phased approach, primary and secondary day schools are to suspend operations from tomorrow. For those in boarding schools, the school administration is to ensure that students are home by Wednesday, the 18th March 2020, while universities and tertiary institutions are to close by Friday, 20th March 2020. Where possible, as number 5, government offices, businesses, and companies are encouraged to allow employees to work from home, with the exception of employees working in critical or essential services. Number 6, in order to avoid the risk of transmission through physical handling of money, we encourage the use of cashless transactions, such as mobile money, M-Pesa and otherwise, and credit cards, and we appeal to mobile operators and banks to take note of the situation that we are in and to reduce the cost of transactions during this period. Number 7, in line with the directive to avoid crowded places, citizens are encouraged to A, avoid congregating, including in places of worship, B, minimize attendance to social gatherings, including weddings and funerals, and restrict the same to immediate family members. C, we call for people to avoid crowded places, including shopping malls and entertainment premises. And D, to minimize congestion in public transport whenever possible. And lastly, E, the limitation of visitors to hospitalized patients in both public and private hospitals. Number 8, hospitals and shopping malls are encouraged to provide soap, water, hand sanitizers, and ensure that all their premises are regularly cleaned and disinfected. Fellow Kenyans, globally, the impact of the virus is still unfolding. I want to assure you that my administration is at the forefront of assessing, containing, and managing this pandemic in our country. Some of the measures that we have taken today may cause inconvenience, but I want to assure you that they are designated and designed to ensure that we effectively contain the spread of this deadly virus. I want to appeal to each and every one of you to strictly observe these measures, but I would also appeal for calm. Kenyans, please let us avoid misinformation that causes panic and anxiety. Let us all remember that as Kenyans, we have been faced with other crises in the past, but we have always triumphed by coming together in the spirit of national unity and cooperation. Every single Kenyan has a responsibility and a duty to play his or her part in safeguarding our nation and the lives of our people. There is no doubt that this pandemic will test us, as it is testing all countries in every corner of the globe. But I don't believe that it will defeat us. If we pull together and everybody does their part, we shall, with God's grace, overcome the worst impacts of this virus. I want to take this opportunity to thank you members of the Fourth Estate for your support, especially in avoiding to sensationalize, but rather provide information that can be and is being useful to wananchi. Let us work together. May God bless you all, and may God bless Kenya.
7 tips for protecting yourself against the coronavirus. 1. Wash your hands regularly with soap and water or with an alcohol-based gel. 2. Need to cough or sneeze? Do it into a tissue or a bent elbow and then wash your hands. 3. Stay at least a meter away from other people, especially if they are coughing, sneezing, or have a fever. 4. Avoid touching your eyes, nose, and mouth. 5. Avoid direct contact with live animals. If this is impossible, make sure to clean your hands afterwards. 6. Do not eat raw or poorly cooked animal products and wash your hands, clean surfaces, and utensils afterwards. 7. If you develop a fever, cough, or difficulty in breathing, seek medical care.
Humanity is at risk and stands at hazardous crossroads. Worldwide, the pandemic's impact on national health systems has been enormous. Even developed health systems feel the strain. Those of fragile developing economies are struggling to cope. The trans-border trajectory of the virus that makes us all neighbors, turn us all into each other's keepers. Above all, it recommends global partnerships across all the divides that may have set us apart. We now have to join hands against this global threat while acting in unison within our immediate national neighborhoods. Impact on national economies, on international relations, and on trade has been severe and continue to escalate daily. In our case, we have seen key bilateral projects in many sectors, notably in transport and infrastructures, either being slowed down or coming to a complete halt. Travel and tourism has taken a knock from a curtailed human movements. In our case, on the back of 2 successive droughts. While we have no recorded cases as yet, the economic impact of the pandemic is already being felt, threatening our Vision 2030. The key challenge we all face is balancing effective measures that are necessary and have to be taken against the need to ensure our societies and economies continue to function optimally for common collective good. Dear citizens, the pandemic has reached our region and we now have to escalate our national response. Above all, we must readjust our lives and behaviors, including foregoing certain fixtures, activities and practices we had grown accustomed to in order to keep the pandemic at bay. This holds true at all levels, at personal, community and national level. Government has decided that the coronavirus pandemic be declared a national disaster. This allows government to mobilize resources and take necessary measures in dealing with the pandemic. With immediate effect and for a unified and coordinated effort, I have directed that our national disaster management machinery extend its mandate and focus to dealing with the pandemic with the Ministry of Health and Child Care as the lead agency. Weekly reports will have to be made to Cabinet. As already announced, government has curtailed unnecessary travel outside the country, especially to destinations in countries affected by the virus. That position remains in force. Travelers from high-risk countries are encouraged to postpone their travel arrangements to Zimbabwe for the next 30 days, starting from 20th of March 2020. Equally, Zimbabweans are discouraged from traveling to, through and from high-risk countries during the same period. Non-essential travel must be avoided or discouraged by all of us. While all our major entry points into the country will remain operational, testing vigorously now put all